Hi, I'm Mike Duggan. I've been teaching restorative dentistry for over 32 years now and to over 6,000 dentists. This video shows how I do it. Real-time, mannequin-based, hands-on, point of view, and patient real. If you are a pre-dental student, an aspiring teacher, an international dentist, join me at Duggan Oral Design, dugganoraldesign.com. I'm going to position myself so my body's between the head and the table, so I can look along the central groove pretty easily. I'm going to go back to my 330 burr. And then as long as I'm looking along the arch, I can see the lingual angulation. Notice I'm leaning it lingually. I'm not leaning it buccally. I'm leaning it lingually. If you try to sit in this position and look vertically downward, you never know what's going to happen, what your angle is going to be. Some people try to look even this way, and then they have the burr leaning totally out to the buccal, totally out of control. So we're going to look along the arch so we know exactly what direction we're leaning the burr. And we can see exactly where we are, buccal lingually. So I can see I'm following the central groove, and I can see I'm going into the distal pit, the distal groove, and including that distal pit right there. And then I'm going to look this way a little bit and make a little mark where the buccal and lingual grooves are, and the distal buccal groove over here. Then I'm going to smooth out the connection between these areas. Make sure all the walls are the same height as the burr while I'm leaning the burr lingually all the time. Try not to have any sharp edges. There's a little sharp edge right in there. There's a sharp edge right over here. Okay, so for amalgam, you get it at least 1 millimeter wide. For composite, just make it the width of the burr. That's the basic outline. Now we're going to cut to the middle of the contact. So I'm going to come around this position, sit behind the patient, looking parallel to the contact, downward at a 45-degree angle. Now I can go ahead and cut right into the middle of the contact with the adjacent tooth, right like this. So see how close I am to the adjacent tooth? But you can see I'm not hitting it because we're all looking in the right direction. Okay, so now I'm going to go out facially. Now at this point I don't know if I've gone far enough. I won't know if I've gone far enough until I lean to the right a little bit and use the mirror. Okay, so I'm going to go a little bit farther facially. Now I'm going to lean to the right again and use the mirror. But you see, I don't have to lean too far to the right. I don't have to move my chair position or do anything that's very dramatic in terms of changing position in order to look down the axis, because I'm working at about a 10 or 12 degree distance from the patient. So there's no need to be moving around a lot to see in different directions, because I'm not that far away from where I'm working. So I can lean this way and check down there. Now I've got my facial lingual clearances. Now I'm going to cut away from each of these margins at the same pulpal floor level. And keep adjusting those angles until I'm happy with my 90-degree angle. So if I'm happy with the clearance and the angle and the length, then I can make a curve to join the isthmus. So on the lingual side, we're looking pretty good. Now I'm going to do the same thing on the facial side. Again, find the margin, find the angle, get the length. Let's see if I've got the right angle. Okay, I'm going to make it a little bit closer to 90. There's the margin. Adjust the angle. Again, trial and error to get the margin, trial and error to get the angle. Once I've got the margin and the angle, I get the length. Then I make a smooth connection to the isthmus. Okay, so as long as we have that done so it looks pretty nice on both the facial lingual, then we can go ahead and go gingerly. So again, looking parallel to the contact, downward at a 45-degree angle. So I can see this wall, so I put the burr wherever I want, axially, drill a hole, cut away from that wall. Now how far am I going to have to go gingerly to get clearance? Probably not too far, maybe I've gone far enough. Then I put the burr against the facial. Now I can't see the facial wall, but I know the burr is vertical by checking this way. And I'm happy with the top part of the facial wall, so I just match the gingival part to the occlusal part. Make sure that you're looking parallel to the contact and downward at a 45-degree angle so you see where you are axially. You also see how close you are to the adjacent tooth. So there's the beginning of the axial wall. We're going to get rid of the excess along the lingual and the excess along the facial. Again, I'm looking so I can see how close I am to the adjacent tooth at all times. Get rid of any excess all the way to the gingival margin. And now we have some gingival clearance, facial clearance, lingual clearance. Now I'm going to define the internal line angle on the lingual a little bit better. Make a nice flat wall into that corner from both directions. Then I'll be able to use the hand instruments to finish it up. Okay, so let me see, I have a hoe. In this quadrant, the hoe fits against the axial wall, but it doesn't really fit against the facial lingual margins. Maybe I can borrow that enamel hatchet again. I can also place retentive grooves with the hoe. That's what I'm going to be doing again by leaning the instrument away from the wall and using the upper corner to cut into the wall, facially and lingually. Thank you. And now I'm going to use the mirror, as always, to use the hand instrument. We have to use the mirror, so I'm going to use the mirror to look down the wall, so I know I've got the instrument perpendicular to the surface when I come down the margins, facially and lingually. So any undermined enamel, any hook of unsupported enamel that I might have at the margin, I can trim it off by aligning the instrument in the mirror first, and then trim from the occlusal all the way down to the gingival, down that margin. Okay. Then I can go ahead and use the gingival margin trimmer, in this case the mesial gingival margin trimmer, to bevel the axial pulpal line angle and angle the gingival floor. Okay, and I could smooth out a couple little areas on the occlusal where the connection is made between the proximal wall and the pulpal floor. Make sure they're at the same level. But other than that, that pretty much takes care of it. So occlusal outline, we're very careful to do, finding the margins, finding the angles, getting the lengths, finding the corner so we can go gingivally with the control that we need. Okay, and then of course we do the same thing as usual. Angling the gingival floor, beveling the axial pulpal line angle. Okay, so that's it. So again, you notice that positioning is really critical over here. You know, right now I'm looking parallel to the contact, downward at a 45-degree angle, but everything looks like it's upside down. It's okay. You see what you need to see, and that's the most important thing. When you're doing the occlusal, you position ourselves like this. So again, we see what we need to see. Wall heights, angle, position. Those are all the key things. Okay. Okay, so let's take a look at 19. All right, so let's see, in the distal pit, I'd probably go a little farther in there. It just seems like you might be just right at the pit. Okay, so this is amalgam, right?
No,
So
composite.
I think I wrote amalgam. No, you're right. Composite. Yeah, I remember I wrote amalgam for the 20. Cool. Okay, so you're diverging your box. Keep the burr vertical in the box. You want to lean the burr lingually in the entire occlusal part.
My diverges distally? Ah, divergent, okay.
Lingually, yeah. So lean the burr lingually for the occlusal, but not in the box. Keep it vertical in the box.
Okay.
Well, remember, we lean it lingually for the occlusal because there's a pulp horn underneath the pulpal floor. There's no pulp horn underneath the gingival floor.
Makes sense.
And then really make sure you look along the arch this way so that you can keep the end of the burr at the same level everywhere too. So keep the end of the burr at the same level all the way around here. Get the same wall height, same level, and then you get a flatter floor and have it leaning lingually all the time. So your floor is kind of irregular because you are probably trying to look a little bit different direction. You miss this distal buccal groove a little bit. See that?
Need to include.
A little bit off of that. Okay, and then I probably would have gone just a little more into here. Okay. All right, and then clearance here, it's a little bit much. You're pretty obtuse. Now, the more obtuse you are, well, you're also undercut. So the true exit angle can only be seen when you're looking down the wall. Oh, let me get this light turned off. And I'm going to turn this light off too. Too many lights around here. Okay, so now I'm looking down here. So we got a little bit too much clearance here, about 0.8 instead of 0.5, but you're leaning lingually so much. So this wall, the lingual wall is quite divergent, the face wall is quite undercut. So if I look down the wall, I can see the angle, and it's a little bit obtuse. It looks more obtuse when you're looking vertically downward, but you're not seeing the true angle of the wall unless you're looking down the wall.
For me, it looks straight.
Well, I'm not saying it's not straight.
Okay.
It's a flat wall, it's straight, but what's the angle? That's the question. Are you saying it's vertical? Are you saying it's got the wrong angle, or what?
I'm saying it's around 90 degrees angle, which is wrong for a composite exit angle.
No, right now, I mean, I'm looking down the wall, and I can see your exit angle's probably 110 in tooth structure.
It's hard for me to see.
Yeah, so 90 degrees would be about like, well, let me see. Let me get the Explorer so it's easier to show. But again, the trick is I have to look vertically down the wall, not vertically down the axis, vertically down the wall to see the angle of the wall. So the 90 degrees would be about like this. Something like this would be 90 degrees. So you're a little bit obtuse, which is fine. But again, if I look down this way, it looks really obtuse, but I can't see the true angle unless I look down the wall. So we don't want to be undercutting that much. It just makes it a lot more difficult. And your pulpal floor won't be horizontal, and you really like to, or gingival floor won't be horizontal. You'd like it to be horizontal. Okay, and then the divergent wall over here, I have to look down that wall to see the exit angle. That's pretty close to 90, maybe slightly obtuse.
Oh, I need obtuse.
Yeah, and and you don't need to sharpen the internal line angles. Okay.
Okay.
Yeah, so if you want to do the prep and have it be
But for amalgam, we do.
vertical, yeah, but
Except
this is
for-
composite.
Yeah.
I
Okay.
think we decided that. Okay, so when you're doing a box, look this way before you start working in the box. Okay, so if you look this way first, then you won't be leaning the burr like this so much. If you don't check from the side, everybody always leans the burr away from their eye. So just look this way when you're doing it, but check this way first to make sure it's vertical. Then you can find your margin stepping on a backpack instead of on the pedal. Get that pedal out of there. Okay, so again, check to make sure it's vertical. Then you can find your margin. Now, in the lower left, it's helpful to put an extra finger behind the handpiece to stabilize it a little bit more when you're cutting in from the margin. So find the margin, cut straight inward, because the burr really wants to slip outward, doesn't it? And so if you put an extra finger on there, you can protect that from happening. So now we have a nice obtuse exit angle right there, and it's a little bit more vertical. But again, a little extra finger never hurt anybody. I like your axial wall position pretty well for composite. And now we're going to make it more vertical. Okay. So I ended up going a little deeper axially, but let's see where we are here. Okay, and then you made a gingival bevel, but it's not real clear. And if I really wanted to get this axial wall, this corner in the right place, I would have done a little more on the occlusal first. When you find your margin and your angle coming in, go in farther, then make the curve. Then you can find the corner of the box a little bit better. You get a little better shape, and then everything's more uniform. But yeah, get a little bit more on the occlusal part done first, and then you can control everything when you go gingivaly more. Okay, and then make the gingival bevel, really easy to see and really clean. Okay, pretty good. Now you're working on this one. Now, this is very, very, very dangerous. So you're trying to go gingivaly, but you don't have your facial lingual walls, you don't have your outline done. You're trying to go gingivaly anyway. That's what gets dangerous. So, well, see, you have clearance here, but you have an acute exit angle. And over here, you don't have clearance, and you have a very acute exit angle. So you need to move the margin way out lingually, then recut that angle 90 degrees inward, come out a little bit more facially to get a 90-degree angle inward. Then you can identify where the corners of the box should be, and then when you go gingivaly, you're going to have much more control. And by the way, don't forget, don't prep on a tooth that's been damaged, even on the other side, because it reduces the size of the marginal ridge. Pardon me?
I didn't know what you said.
I know. Yeah, people don't unless they really look to see that they have no damaged tooth. Anyway, it makes the marginal ridge smaller, so it's harder to see where the relationship is between your dovetail and the marginal ridge. And you will make a little bit of a dovetail here, coming out facially. Typically a little dovetail, a little extension into that lingual groove. But yeah, find your margins, find your angles, and then you can go gingivally. And a lot of times people go gingivally, but they go far and then they don't clear off all the excess, steps 5, 6, and 7. If you don't clear off all the excess, you don't know if you've gone far enough because you have no gingival margin, so you can't see how much clearance you have. So anyway, back to the occlusal on this one. That'll make it better. Okay. Oops.
Thank you.
Yeah, so don't get in the habit of having the patient be too vertical. Okay, so we're going to pay really careful attention where the grooves are. You got one too many grooves, right? So there's a distal groove, which is right here. There's a distal buccal groove, which is right here. Buccal groove, lingual groove, but there's no groove here. Right? There's no distal lingual groove, just the distal buccal groove. Right? So you're extending where there is no groove. So be a little more careful about the exact anatomy. So if you extend where there is no groove, the wall is going to get really tall, won't it? Yeah. That's why the wall is so tall there. Okay, lean lingually all the time. Look this way all the time. You can make the extension into this groove a little bit smaller. See, this is a nice look to it right here. The shape of that extension is nice, but again, the distal groove is right here, so you missed it on both sides. So you can see the remains of the distal groove right here. Now if you're looking the way I am, you can see exactly where the groove is. Then you just extend right into it, come right back again.
Oh, I didn't get you. Can you please repeat
Okay,
that?
if you're looking the way I am along the arch, you can see exactly where the distal groove is.
Okay.
It's right here. So if you look over on the other side, it's obvious where the distal groove is right here. So if you're looking this way, before you cut it all away, you would have seen it. Now, but you can see what's left of the distal groove right here. See that white line there? So that's where the groove was originally. So you missed it on this side, and you also missed it on this side.
Yeah.
Just look this way, go straight into it, come straight back, then you're okay. All right, so facial lingual clearances, okay, a little much. Composite prep, so this is a little bit obtuse. This is got a kind of a rounded margin here. You're a little bit obtuse. We could get away with that. How are you going to control your axial wall position a little bit better, though? So let's come around here. So if I want to control the axial wall position, oops. Okay, so I can look this direction, so I can see where I am axially. I can see where I am axially on the facial side, I can see where I am axially on the lingual side. You want to see the difference between this and this, this and this. This is pretty deep axially over here. This is where it should have been, this is where you were. So just practice looking parallel to the contact downward at a 45-degree angle so you can see where you are axially all the time. Once you've got the facial lingual walls done on the occlusal, just drill down gingerly at each wall and cut away from each wall. But that's where the axial should have been, right where I was sort of polishing a little bit there. So again, looking in the right direction makes all the difference. Make sure you have nice clean margins, nice flat walls and the margins inward. On the lingual, you might want to use an extra finger behind here. So you don't have to worry as much about the burr slipping out this way.
Okay.
So a little extra finger is a big help to get a nice flat wall all the way to the margin. So try to get that wall flat all the way to the margin. So now you see yours is kind of rounded. You can see the gindle part of that wall kind of rounded at the margin, isn't it? Mine's obtuse, but yours is just kind of vague and rounded. It would still work, but it's just not as well defined as you want to do in an exam situation. And if you didn't get really good adhesion at your lingual margin, the thin composite right there would tend to chip away. So you got to make sure you restore it really well when you have such a very, very small exit angle right there, very beveled. Okay, and then once you smooth out that gingival floor, make sure you bevel the gingival margin. Gingival clearance, a little much. Normally we have half that, and then we bevel it to achieve something like 1/2 millimeter. Okay? All right, so I gotta ask, why did you extend in this direction here? So you've got like you extended here and here and here, but typically we extend into the lingual groove right here, that's fine, but then just make a little dovetail out here. Just a normal kind of dovetail, only going facially, nothing goes lingually there. We don't need to extend lingually in here. Okay, you can preserve this triangular ridge. The triangular ridge for the distal lingual cusp you should be able to preserve better. And then don't cut your dovetail so far into the facial cusp. Obviously, lots of clearance here, right? And I can tell the burr kept slipping out this way, right? So how are you going to prevent that from happening? You might try a couple extra fingers again. You can try something like this. But of course, if you get this much clearance, there's room for the burr to go through here, isn't there? So if there's that much room, it's more difficult. But we can still try to very carefully cut from the margin straight in. Get a flatter wall all the way to the margin. Okay, that's a little bit cleaner. Now your corner here, Okay, so you're making a pretty good retentive groove. So this one's looks like it's with a hand instrument. This one you tried to use the burr.
I used both. on
Okay,
both
that's
the
good.
sides.
Okay, you don't want to have it come up so far to the occlusal. Just keep the retentive grooves indented, and don't make a hole in the gingival floor with the retentive groove. Don't need to be doing that. But you don't have enough gingival clearance. So it's a place where the gingival margin is closest to the adjacent tooth. That's where you check the clearance. This is where the decay would mostly have been located. So that amount of gingival clearance probably means you still have decalcification there. And how do you control the axial wall depth? The axial position? We can look this way. And then I would have had the axial wall a lot more conservative here.
I agree. But I think this is the first time I haven't damaged the adjacent tooth that much.
Okay, good. That means you're looking in the right direction. And so now we have a different position and shape for the axial wall, huh? So again, sitting in this position, I can control that, but I can also see where I am relative to the adjacent tooth, so good. You didn't hit the adjacent tooth so much, but again, when you're looking this direction, you can also control your axial wall position as well as where you are relative to the adjacent tooth. As long as you're always seeing how far the burr is from the adjacent tooth, that's what gives you the control. Okay, so coming along on that one. And you know, you can practice recutting margins inward. You want to have a nice sharp burr when you do this.
I tried to do that, but I was getting acute angles. Like the...
Well, typically what happens is the burr slips outward and you get a rounded margin. We're just trying to adjust the margin so the wall's flatter all the way to the margin. And then if you get an acute angle, you might have undermined it with a retentive groove or something like that. But if you're getting an acute angle, you can always change it by moving the margin out farther. Now you should have had the margin more like here. And then coming in at a 90-degree angle. So again, find your clearances. Like this is not terribly much. Find your clearances very, very carefully, and then cut inward, and then adjust it very, very carefully until you get the angle that you want. Then get the length, then make the curve, then find the corner. But again, look this way when you're working in the corner so you know where you are axially. Okay? All right, you're coming along. Oops, that's fine. Okay. Okay, so let's check 19. Okay, so the distal side got kind of messy. And you have a lot of walls that are shorter than the burr, aren't they? You want all the walls the same height as the burr. And then when you go distally, just make sure you lean the burr lingually all the time. Extend very definitively into each of these grooves. But the distal groove, you just go into it this way, and then you come back again. You go into the groove, you come back. You go into the groove, you come back. Don't wiggle around back in there. Just cut into the groove, come back. Don't go up here, don't go over here. Don't go that far distally.
Okay.
Just look this way so you know you're cutting straight into the groove, then just come back. Then you start to smooth out everything in between. And then we have an outline form that looks pretty good. And again, make sure all the walls are the same height as the burr. And then you can't miss. Okay, so now let's turn around this way. So this is the composite prep. Too much clearance on both sides. This wall is not flat at all, so it's hard to tell what your exit angle is, isn't it? You have many exit angles. Over here it's also not very flat, but you can see it's mostly obtuse toward the occlusal. Gingival clearance is okay. But in the box, we're going to make sure we keep the burr vertical, right? So look this way. First, check this way, make sure it's vertical, not leaning lingually or buccally. Vertical. Then you can work on the occlusal part of that outline. Now use an extra finger behind the handpiece if you want to help protect the burr so it doesn't slide out. In every prep, use a new burr. Okay? But cut a nice clean margin. Come in as straight as you can. There's still a little bevel toward the top of that wall, but find your margin, find your angle, get the length, keep the burr vertical, but get the length inward until you get past where you want the actual wall. Then you can make a smooth curve here. So now we have a nice 90-degree angle, a nice flat wall, except we want an obtuse angle here, right? It's composite prep. So I'd have to go a little bit farther lingually with the margin, and then recut that angle coming inward. But make sure whatever angle you get, you make it flat and long and a clean margin. And make it long, and then make a nice smooth curve to join the isthmus. Okay, so now we have more of an obtuse angle, but you see the bottom part of your wall is still left, and it's undercut and it's curved. But it's also curved. So now we can come down that wall again with the burr vertical. So double check it to make sure it is, and then come down the wall in the corner. And then use the end of the burr. The 55 burr is designed for this to get rid of all the excess. All the way over to the margin. Be very gentle about it. Again, I have a extra finger behind here to keep the burr from slipping outward. If you have this much clearance, the burr has room to go through, so you have to be very careful to try to prevent it from happening. This last little bit you might trim away with a hand instrument. Okay, and your facial clearance, even though it's too much, your exit angle is pretty good. Corner of the box should have been about right here, and the axial going this way. So try to keep the corners of the box, the axial in the right position. Okay, but otherwise your gingival clearance is good, so now you can make the bevel. So let's see how that works out. Okay, so you're going to make a regular dovetail on at the distal marginal ridge, but the dovetail goes facially, not lingually. Okay, you lean the burr lingually and you cut in this direction, and look how close you are to the marginal ridge here.
Yes.
So you should have been more like about here, and then have the dovetail come out facially, and then there's a lingual groove extension over there. It's just a simple, normal foot-shaped dovetail right here. And then keep the isthmus a little more narrow.
Positioning is really tricky.
Well, no, you're looking along the marginal ridge, so that's not difficult as far as position. I know I'm leaning the burr toward the marginal ridge. So I don't want to be, I lean it toward the marginal ridge, I position it where I want to. Now the wall height there is kind of short. So maybe we should have been a little deeper pulpally. And then connect it over here. We're going to look along the central groove when we're working in the isthmus. So look along this direction. You can make sure you're leaning it lingually all the time, and mostly you are. But it's pretty wide, isn't it?
Yeah, it's wide.
So look this way so it doesn't get too wide. So you want to, while you're doing this, you want to see how wide it is while you're doing it so you don't get too wide. If you're looking some other direction, it's going to get too wide. All right. Okay, so obviously your clearance here, you got out too far, and you got out too far here too. So again, once you get to the middle of the contact, just take your time and go lingually a little bit at a time until you get just the clearance that you want, and keep checking, trial and error until you get just the clearance that you want. And then you start there and cut straight in until you get the angle that you want. In this case, 90 degrees, right? So find the margin, find the angle, get the length, make the curve, find the corner. That's the basic approach that we take every time. Okay, but we could have kept that margin a little bit less extended. And over here, we want the margin about right here. Doesn't have to be all the way out there, okay? So you get the margin way too far out. You've got a little bevel with that margin. You're cutting in and making basically a pretty acute angle here. You're cutting all this tooth structure away that you want to preserve that triangular ridge, really carefully. So I think the problem was you were leaning the burr lingually, and you let the pulpal floor rise as it came facially. It was shallow to begin with, and you let it get even more shallow as you approach the facial margin. So then you have a really short wall, and you're undercutting it, and that's a recipe for disaster. You're always going to get overextended when you have that situation. Short walls are easy to overextend. Tall walls are hard to overextend. Okay? All right, so keep working on that. We'll assign an afternoon homework session in just a minute or two. Okay.
Okay, I know I did a mistake with the outline, so I'll pencil it now. I have a class 2 MO on the same tooth next week for bench, so
Okay.
I don't want to be.
Okay, let's take a look. So there's a distal groove and a distal pit right here.
Okay.
There's a distal buccal groove right here.
Okay.
Buccal groove, lingual groove. So your central groove is around through here like this, right?
Okay.
So on the outline, all you had to do is extend here and include that pit and that groove.
Okay.
Then extend up into here. What you did is you went up here.
Yes.
No need to go there. There's no developmental groove there, no secondary groove there. So just extend up into the developmental grooves. And then you're going to be okay. Okay, let's take another look at what you did.
On this and show
So here's what you did that's a big problem right here.
Yeah.
Okay, and you missed this groove here. And this is the distal groove, so you missed that one there. So again, look this way and come right into that groove. Okay, what was your question?
Can I do amalgam class 2 on this and show you?
Sure, absolutely, yeah. Okay. Oh, wait a minute. Where's my mirror? Oop. My mirror? You probably have my mirror, right?
Black.
Thank you. There we go. Thank you. Cool. Picked up some fingerprints. Okay, so looking along the arch, we can see exactly where the central groove is, and this is a little different burr.
Yeah.
Yeah, see the end of the 50, and this is a smaller burr, but the end of the burr is shaped differently. So the 55 burr is a little more recommended than what you've been using. Okay. So again, we want to make sure we have the burr leaning lingually all the time. So over here, you're leaning it facially. Sometimes you're leaning it lingually, sometimes you're leaning it facially. Lean it lingually all the time. Let's stop and make sure that the typodont is connected to the mannequin rod at the appropriate place so that things don't rotate unexpectedly. See the flat spot right here? That's where the screws tighten. Remember that? That's where they tighten. Now we're safe. Okay, so anyway, let's see how you extended. So you overextended into here. We don't cut up into this triangular ridge. But okay here. You just about got it over here on the distal groove. So we just extend into the distal groove and then come back again. And don't be extending lingually there. Just into this groove, into this groove, into this groove, into this groove. Then keep the walls uniform in between. We can see that all the walls are the same height as long as we're looking this direction. And using the 330 burr, and have all the walls the same height as the 330 burr. But make sure you're looking the way I am, seeing what I do, and you can see everything you need to while you're doing this. The pulpal floor will be flatter, and your outline form will be much more uniform. Okay, but you see, you cut into an area there where there was no decay. Okay, good facial clearance. We can clean that up a little bit with a hand instrument, get rid of that hook there. Exit angle is a little obtuse, but not quite flat, but you're close. Over here, where your exit angle is a pretty good 90-degree angle, but we want an obtuse exit angle here. Axially, you're having some trouble, huh? So, again, controlling the axial, it's just a matter of controlling the corners. So, wherever we have the lingual margin and the lingual exit angle, notice I put an extra finger behind the handpiece to stabilize it in this area. Find the margin, find the angle. Get the length. So as soon as you find a margin and an angle that you like, so you see at the bottom part of that wall you still have the acute part. Then put the axial about right here. And then come away from that wall toward your eye this way. Okay, and then get rid of the excess to match the general part of the wall to the occlusal part of the wall. Still keeping an extra finger to stabilize the handpiece when you get this much clearance. This is where the axial should have been. So about right in this area here. Now, when you try to do this prep looking vertically downward, okay, you're going to overextend axially and you're going to kill the adjacent tooth. And so a lot of times people try to do that and it never works. So this is the same situation that we've had on all the other preps. Look parallel to the contact, downward at a 45-degree angle. And then just do the occlusal part nicely, and then put the burr where you want it axially. I can see where I am axially. I can see the difference between this and this. Okay. Even though I can't see the wall, I know where the burr is axially. Then I can control what I'm doing, and I can also control how close I am to the adjacent tooth. So as usual, it's all a matter of looking in the right direction, isn't it? Okay, so for composite prep, you want to get a nice, smooth, gingival floor with just a little bit of clearance, and then you can bevel the gingival margin, but I don't see any bevel there. So until you've beveled the gingival margin, you haven't finished your prep. And if you haven't finished your prep, don't start on another prep. Okay? Okay, notice on this one. So I'm looking along the arch so I can see the angulation of the burr. So notice that this should be the angle, and you're leaning it this way. That's pretty dramatic. All right? Look how dramatic it is. So here's vertical, here's leaning lingually, but you're doing it this way. So your pulpal floor is exposing the buccal pulp horn. Okay, so again, look along the arch so you know the direction you're leaning the burr. Then you know you're leaning it lingually. Then you have some control, okay? Okay, but that's the biggest issue. You had totally the wrong angle. Okay, your dovetail is a little big, but you got the right idea there. You're leaning it toward the marginal ridge, maybe a little bit farther from the marginal ridge. And just a little extension into that groove, nothing much. Okay, so there's a lot of undermined enamel on that lingual margin, isn't there? So what should I do?
Hand instrument.
No, that's way too much for a hand instrument. So how should I proceed to fix that? Okay, well, if you don't know how to proceed, then of course you can't fix it. Then you leave it there and then you fail. So you've got undermined enamel, so you should proceed by removing the undermined enamel. Make sense?
Yeah.
In order to do that, we have to move the margin farther out. We have to move the margin out to about here.
Okay.
So I can create a 90-degree angle again. But that means overextending. But with this much undermined enamel, you fail for sure. There's no doubt whatsoever. So find a new margin, cut a 90-degree angle, and now all this undermined enamel is restricted to the bottom part of that wall, to the gingival part of that wall. So once you've got a new margin and 90-degree angle, then you can find the corner of the box, then get rid of the excess to match the gingival part to the occlusal part. Now we got rid of all the undermined enamel, all the way down to the gingival floor. Okay? Now, we didn't want to have to extend that far, but you have no choice.
Got it.
You force yourself to. When you have that much undermined enamel, you have no choice, but you've got to overextend. And the overextension will, in this case, probably fail you, but the undermined enamel would definitely have failed you. Make sure you're always looking parallel to contact, downward at a 45-degree angle, so we know how close we are to the adjacent tooth, okay? Okay, on the facial side, you're a little better in terms of angle. You're tending to lean the burr facially, though. And that would normally be caused by somebody that's trying to look this direction.
Yeah.
Well, you're always going to lean the burr away from your eye, so that's why we never look that direction. We always look just one direction. Double check to make sure the burr is vertical, and then we do trial and error to find the margin and the angle and the length and to make the curve, and then find the corner looking this way. We know where we are axially, and that's all you need to see. Okay, but you don't try to see each of those walls. There's always one wall that you can't see, and it's best to get used to working with it when you can't see it. Easy to work with it when you can't see it if you've already finished the occlusal half of it, right? Okay, so work a little bit more on each one of these, but make a gingival bevel over here, and that's going to take care of all that roughness you have on the gingival margin. Okay, cool.
Cheers.
Thank you. Oh, okay. All right, so this is not an unusual situation. See the extension that you did into this area here? Right? So you extended there, right? So you'd think that that would be because there's a groove there, but there is no groove there. The distal groove is here. It's not over here, and the distal buccal groove is here, so you missed that a little bit too. Facially, lingually, you're not too bad. So this is where the distal groove was, right here. Lean the burr lingually, not buccally. Lingually. Remember, we're trying to protect the buccal pulp horn. Lean the burr lingually all the time. Follow the central groove and then cut right into the distal groove right here until you include the distal pit. This is where the outline form goes, right here. Not over here. Okay? And then make sure when you're using a 330 burr, having it leaning lingually, you make sure all the walls are just the height of the burr. And that'll control how far you go into each of these grooves. But make sure all the walls are the height of the burr and all the walls are made by leaning the burr lingually. Then you're in control. Okay. So, okay, this is a composite prep, so you're pretty close to 90. I'd rather you got a little bit more definitely obtuse. Your gingival bevel is okay, except for it doesn't quite connect to the lingual wall. On the lingual, I think you're a little bit acute, actually.
That's more like 90.
No, it's more like acute. Okay, so if I look down that wall, the tangent would be about like this. So you're a little bit acute. So let's put an extra finger behind the handpiece to stabilize it. And then we can move the margin out lingually a little more. Just fixing it at the occlusal level first of all, at the level of the pulpal floor. Find the margin, find the angle, get the length. Now let's see if we have the angle. Now, okay, so it's closer to 90 now, but we still need to get obtuse, so we need to change it again. So move the margin lingually and then recut the angle inward. So now we're a little bit obtuse. Now let's define the corner better. right down that wall, and then cut away from the wall in the direction you want to curve the axial wall, so just toward your eye, basically. Now let's get rid of this step at the bottom of the wall. Get rid of the excess. This is what we always do. We do the occlusal part of a wall, clearance, margin, angle, length, curve, then the corner, then get rid of the excess to match the general part to the occlusal part. That's the routine. Then we always end up with something that's going to work. So now we have a very well-defined internal line angle. The axial should have been going this way. Okay, you can use a hand instrument. There's a little hook there that you can trim off. Over here it's kind of rough, isn't it? You have a lot of different angles and so forth. Don't undercut the wall. Keep the burr more vertical. But again, if you want to change anything, if you want to improve anything, change the occlusal part first. Margin, angle, length, curve. Then you can find the corner of the box right where you want it, and then define everything. Okay, so anyway, a little more attention to the occlusal part. Make sure you're really happy with nice flat walls all the way down to the gingival. Then you can make your bevel, and it'll join smoothly into the facial lingual walls a little bit better. All right, pretty close though. So on the premolar, pretty wide, even for amalgam. Yeah, you're cutting too far lingually over here. You're a little too close to the marginal ridge, but not terribly. Definitely having a problem on that lingual proximal wall, huh? Okay, so when we do the occlusal, we always look this way. So you know the height of the walls, you know you're leaning the burr lingually, but part of the time you had it leaning buccally, so always lean it lingually, and then make sure you see exactly where you are facial lingually. You can see how wide the isthmus is, you can see where the isthmus is. Everything you can see if you look that way. So make sure you do look that way. Then coming over here, we would like to stop without getting quite that close. You're almost to the top of the oblique ridge. It would have been nicer to have a dovetail maybe here. Then a little extension, just a small extension into that lingual groove. That would have been a little more typical outline form, so you got much too big in this area. Okay, now what are we going to do about that lingual wall? It's definitely acute, isn't it? So what are we going to do to fix it?
Actually, on the lingual wall, the bar was dropping in the embrasure area down, so I just stopped.
Okay, well, but you have an acute angle. You have to fix it. You have no choice. The lingual wall is
After
acute.
getting the clearance, so that there's space, the bar was going down. So
Okay, well let me ask you again. What are we going to do here? You have your clearance is not bad, but that doesn't matter because you don't have a 90-degree angle.
Changing the angle from the occlusion, and then
So what do we do first? In order to change the angle, what do we do first? Where do we change the angle first? In order to change the angle, in order to get rid of undermined enamel, we have to move the margin first. We have to move the margin. Then we can change the angle. Remember, we always do the margin, then we do the angle. And we do it only at the occlusal level first. So find a new margin and then a new angle at the occlusal level. So if we like the margin and the angle, now of course we're overextending, so we don't like the margin so much. But we need to get a 90-degree angle, get the length, then make the curve to join the isthmus. But once we get a 90-degree angle, then we can come down that corner, then we can get rid of the rest of the undermined enamel toward the gingival. See that acute angle in the gingival half? All that's undermined enamel. So once you've fixed the occlusal by doing the margin and then the angle, then do the corner, and then get rid of the excess to match the gingival part of that wall to the occlusal part of that wall. That's how we change things. We change things by changing the occlusal part first, and then matching the gingival part to the occlusal part. That's how we change a wall in a class 2. Okay? Now your axial should have been going this direction and this direction. So again, keep track of what direction the axial goes. You want it to be pretty much following the curvature of the tooth, don't you? So come down this wall, cut away from this wall, come down this wall, cut away from this wall. I can see how close I am to the adjacent tooth. I can see how deep I am axially everywhere. So we don't have any trouble getting the right curvature on the axial wall. Then get rid of the excess. But you see you went pretty deep axially. So if you're looking in this direction, you're not as likely to go too deep axially. Okay, and keep the burr more vertical. Don't start leaning the burr away from you. You're going to undercut that wall. It makes it much more difficult. Now you need to go down gingivally a little farther because you don't have enough gingival clearance. So you could drill a hole right here. And drill another hole right here. And of course use a new burr and then cut away from this wall this direction, cut away from this wall this direction. Get a new axial wall, really short but a new one. Confirm to yourself that you can actually keep control over the axial wall when you're looking this direction. Then get rid of the excess and you'll be fine. So sit down now, look the direction I am with a new burr, look the direction I am, and then finish the gingival floor and get some clearance down there, but make the axial wall in a different place. Okay? That'll be cool. All right, so looking down here, it could have been a little more conservative about your extension of that distal groove. There's no distal lingual extension. So just look this way. Make sure you have the burr leaning lingually all the time. Don't lean it buccally ever. Lean it lingually all the time. Keep all the walls 1.5 millimeters tall. Cut into that distal groove, then come straight back. Preserve the triangular ridge here. So preserve the triangular ridges between each groove. Okay, so into the groove, into the groove, into the groove, into the groove, and preserve the triangular ridges in between. Then you get a nice curved surface, and you keep all the walls the same height, and then you're going to be fine.
Is this wider than it should?
Well, look over here. I'm just showing you that the triangular ridge here, you cut way into it, didn't you? So you could have had the triangular ridge much more preserved here, and that would have made the isthmus a lot more narrow. Over here also. So you're looking the way I am, then you can control all of that. Okay? Looking any other direction, and there's parts of that that you will never be able to control. Okay, so when you're working in the box, make sure you have the burr vertical. Look that way first, then you can go ahead and work in the box. So you got a lot of that lingual wall is divergent quite a bit. Now, got a lot of damage on the adjacent tooth. Again, look this way so you know you're not hitting the adjacent tooth, okay? Check first this way, make sure the burr is vertical. Then you can find your margin, your angle, your length, your curve, your corner. Then you get rid of the excess along that wall. All the things we normally do, keep the axial wall in a nice controlled position. But, you know, practice doing all those steps with the burr more vertical. So this is quite obtuse, but at least it's a composite prep, so it works out all right. But it makes it harder to find a nice corner for your box. We want to have a really well-defined corner. Then it keeps the axial wall shaped better. Now, your gingival bevel is nice here. Make sure it connects smoothly to the facial and lingual walls. Don't stop. Don't leave a little step where there's no bevel. Start the bevel at the facial wall and then cut toward the middle. So take that other burr, put it against the wall, cut gingivally right at the wall, and then away from the wall toward the middle. That's how we make this, the bevel make a smooth connection to the facial lingual walls. Okay, coming along though. Okay, this one, this is a composite prep or an amalgam prep?
It's amalgam, but it's very obtuse.
You're exactly right. It's very obtuse. So how'd that happen?
I think I need to extend the internal angles more
Well,
facially.
you need to change, no, you need to, at the occlusal level, you need to change the exit angles.
Okay.
Then you can work on the internal angles. Again, we always fix the top of the wall first. And why do you extend here?
The buckle, yeah, I shouldn't have.
There's
It
no
only
groove
the
there.
lingual.
Yeah, there's a groove there, obviously, so extend there. Make a dovetail going facially, the way dovetails do. But yeah, nothing over here. So, and again, we're going to be looking in this direction. And every time you do a little bit, check in the mirror to see how you're doing. So, yeah, you're doing an amalgam prep, right? So, find your margin, find your angle, cut straight in, and then check your angle, see if it's 90 degrees. When you get to a 90-degree angle, make sure you have the right length, then make sure you have a smooth curve, then you can find the corner of the box, get rid of the excess gingerly, match the general part to the occlusal part, and then we fix that wall. Okay, so those are the steps. The same steps we do when we do the prep, basically. So margin,